right, join me as you and I dive into the mystery of what is really causing UTI in male. In fact, the statistics shows that about 60% of women will have UTI symptoms in their lifetime. And so we know that women are prone to have more UTI than male. But what is the real statistics of male, we men having UTI? And the reason I bring this topic up today is because I've had many men, contact me and they call me on virtual visits wanting to get antibiotics for symptoms they are having. Now, the statistics shows that about 12%, up to about 12% of male will have UTI symptoms one time or the other. And so today, let's dive into what are some of the causes of having UTI in male, and what are some of the predisposing factors, and also how do you go about treating male who has UTI? Can you just give them antibiotics and let them go, or there is more you need to do? So let's dive into it today. Now, most of the common agents of UTI in male is caused by a bacteria. And I'm not going to mention the bacteria name, but one is E. coli is one of them. And there are other bacteria like Klebsiella, Pseudomonas, Proteus, different kind of bacteria can cause UTI in male. Now, in younger people, most of the symptoms of UTI, you have to rule out sexual transmitted pathogens like chlamydia, gonorrhea, especially in the younger population. So if you are young, up to about 35 years and younger, and you are having burning sensation when you pee, or you're developing certain blood in your urine, which I'm going to discuss on the symptoms of UTI, then you probably should be checked out for sexually transmitted infection, especially if you've been having sex without protection. Okay. Now, there are certain predisposing factors that can lead to UTI in male. Number one, if you have a large prostate, your prostate is enlarged, what happens is that urine is, you don't empty your bladder completely, and so you have urine in your bladder with colonization, bacteria will grow, and then you start having symptoms of UTI, which we'll talk below. Also, if you are somebody who does self-catheterization, or you do have a Foley catheter in place because of certain diseases, you have a high chance of having UTI. If you have a kidney stone, yes, a kidney stone can also cause UTI symptoms. Or if you have what we call neurogenic bladder, where you did not empty your bladder completely due to certain medical conditions that can prone you also to have UTI. If you have diabetes, yes, there's a high chance of you having UTIs if you have diabetes. Or if you're immune suppressed, you take a lot of immune suppressed medication that will prone you to having UTI. And also people who have anal intercourse. If you have anal intercourse, your chance of having UTI is very, very high. Or if you have a chronic prostate infection, we call prostatitis, that also increases your chance of having UTI. Now, what are the most common symptoms of UTI? Well, we can divide this into the lower UTI, that is the cystitis, which is the inflammation, infection of your bladder, or the urethritis, which is the little tube through which you pee. If it gets infection, can go in there, and you can have also symptoms of UTI. And most of the time, the symptoms that people experience is painful urination, all right, or frequent urination, or just the urge to go, but when you go, you don't really pee, all right? Or you have low abdominal pain, or pain around your pelvic area, or sometimes you have cloudy urine or foul-smelling urine. People, complain about that as well. Or blood in your urine, or you have like a white discharge after you pee in your urethra. Those can be signs of UTI involving we call that lower UTI. Now, when it gets higher up in your kidney area, then you start to experience fever, chills, pain in your lower back where your kidneys are, nausea, vomiting, fatigue. And so if you start having those, that means that the symptoms have gone into your kidneys, and you should rush to the ER immediately, because that can cause you to become very septic, okay? Or if you have prostatitis, that means the inflammation of the prostate, then what you may experience, you may not have painful urination, but you may have painful ejaculation, okay? Or just difficulty in urinating, you just can't pee, or pain around the perineum area, that is the area between your anus and your testicle. You have pain around that side, or you may have a low-grade fever or even high fevers, okay? So these are some things that you would watch out for. If you're a male and you're experiencing these symptoms, then you may be having a UTI, either low level UTI or high level UTI when it goes to your kidney, or it just your prostate, just have infection of your prostate. Now, the diagnostic workup, the caveat is this: most men, approach the come, especially these days that we have telemedicine and virtual care. Most men will approach and they want antibiotics right away for treatment, because some doctor give them antibiotics one time or the other without doing the proper workup, and so they present and want antibiotics, but which is not the right thing to do, because any male that has any of the symptoms I described above, the first thing you want to do is to get a urine analysis and get a urine culture. And if they are younger, like 35 years and below, and they have urethral discharge, that discharge coming from their penis, then they need to rule them out for STI, the sexual transmitted infection. It's very, very important that is done. So that is a basic thing you want to do to isolate the organism that is causing the symptoms. Because if you do not isolate the organism and you just give somebody antibiotics, you are doing the person harm. So if you go see the doctor and you're a male, they don't do any urine analysis and you are giving antibiotics, they are doing harm, because what they are doing is that they're giving you medication that is like broad. They are not targeting the organism that is causing your symptoms. And what's going to happen to you is that you're going to develop resistance to antibiotics, and the next time you develop a UTI, you will need to be in the hospital, because most of the oral medications will not work for you. And I've seen this before, and that is why in today's video I'm really emphasizing that if you are having any of the UTI symptoms, don't call virtual care, don't do telemedicine. You'll be wasting your money doing that. Go to an urgent care, get a urine sample, and if it's during the daytime, you can call your primary care doctor's office. Do that so that they can get urine samples to isolate the culture. And if you are younger, you need to test for sexual transmitted infection. So of course, if you have fever and back pain and you have high-grade fever, you should go to the ER immediately, because you're developing a higher UTI. It could be pyelonephritis, the infection of the kidneys, and that can be very detrimental, and you can even develop sepsis, which is very serious if you don't go to the ER. So if you have any of those symptoms, high-grade fever, then you should go to the ER immediately. But if you don't have a fever and you have any other symptoms, then the first thing is to isolate the organism that is causing the symptoms so that it can be treated. So until you see a doctor, one of the things that you can do to help you is to increase your hydration. You can get what we call Paridium, which is over the counter. It's a yellow pill called Paridium. You can go in and get it, and you don't take it more than 2 days. But the reason you're taking it there to reduce some of the symptoms of the burning until you get in to see the doctor to help you get the organism and treat you completely. Now, another thing you need to avoid once you have the symptoms: avoid most irritants like smoking, caffeine, alcohol. You need to stop any of those things so that you will not irritate your bladder more and have more symptoms. So in a nutshell, this is how, if you're a male and you're experiencing any of these symptoms, then you should be seen immediately. Now, I hope this video has been very helpful to you, and I want to share with your friends. And also, if you're having UTI symptoms and you've been treated before and you agree with what I'm saying medically, come back here and leave us your comment how it helped you. Now, my next video, I'm going to tell you how you can prevent recurrent UTI in male. I already done a video on how to prevent recurrent UTI in the female, but I'll do another video here to help you understand how you can prevent recurrent UTI in male. and so that you and I can be able to take care of our health. Like I always say, in the 21st century, you are your own doctor. So take care of yourself. Until then, I'll see you on the next video.